Very excited to have Dr. Erkeda DeRouen on the show. She is a principal consultant at Digital Risk Compliance Solutions. And on a prior show, I've had her on and I've always enjoyed my conversations with her. Dr. DeRouen, welcome to the show.
Thank you so much for having me.
Great to have you today because we're going to talk about an important subject that I know I've come across in my practice in working with healthcare organizations that are looking to bring on more physicians on staff because they have a recurring need for physicians because of the turnover. There's really an issue with turnover and retention of physicians. And so I wanted to bring an expert like yourself on so we could talk about just some strategies that perhaps organizations could use as it relates to retaining more of these physicians, which could help improve in terms of not needing as many new positions filled, being able to keep more of their current staff. And it can really help, I think, across the board, not just with physicians, but also other healthcare professionals that support the physicians. So thanks for coming on the show. What do you think are the main challenges that organizations face in retaining physicians today? Is it really a problem? And what do you think are the biggest challenges?
I think that there is definitely a problem going on in the healthcare system. I think that we're at a turning point because we've all heard about how a lot of physicians were deciding to leave medicine and other healthcare providers. And I think once the pandemic hit, it was like a mass exodus. And now we're at that point where we're trying to figure out where we're going to go. Our physicians staying, our nurse practitioners staying, our physician assistants staying. And then we also have that retiring population that's coming up too. So we're hemorrhaging providers, but not necessarily able to bring them back in. And some of that can be due to burnout. I think a lot of times, especially during the pandemic, people had a lot of time to reflect, to explore other things. So now we're at the point where organizations are needing to step up to the plate and allow for a lot of the things that are going on. For instance, we're kind of having a digital health kind of revolution right now. So there are a lot of people who are clinicians in medicine who are exploring those things and those avenues. So now it's at the point where we're definitely seeing a lot of those things are helping. So now more traditional systems and private practices are needing to implement some of those changes as well.
Makes sense. One of the things I've gotten as far as feedback from physicians is a frustration with these evolving EHRs that really involve more and more note-taking, more and more keeping. And with the increasing load of the patients, it really makes it difficult for them to finish their job at the end of the day. So they find themselves hours and hours after the day is over, making sure that all these things are notated. And so that's been a big frustration for a lot of physicians. What do you suggest in that area to be able to still stay compliant with the payers and compliant with the government, but at the same time helping these physicians to really achieve some level of work-life balance?
I think that's a very important point that a lot of people are looking into because the workload is continuing to grow as you add on different patient numbers. And yes, for certain specialties, it may be a little easier to do your notes because they're kind of similar thing every time, or they're using the dragon to dictate. But then there are other specialties where either they have a tremendous workload where they have to see their 50 patients in a day and then go and notate them afterwards and document that, not only for legal ramifications and the standard of care, but also to just have the documentation down to showcase what you talked about with the patient so they'll understand it, so you can get reimbursed. And so when you follow up with them in the next time, you'll know what happened and you'll have it documented what you recommended. So there are primary care physicians in particular who spend hours after clinic doing work in the evenings, on the weekends. There was a study that came out recently, and I don't remember the exact number of hours that it said, but it definitely said that the amount of care you do each day, including your notes, you would need, I think, about 27 or 28 hours in a day to actually do it effectively. So that doesn't exist. So that came out
Right.
recently. So we definitely have to think about utilizing and leveraging technology to help with that. So there have been some systems like Kaiser who come out and they've been working to try to help people manage their inbox, because now patients can message you on the portal, which is wonderful for patients and it's giving them more access. But not only does the doctor now have to go and see you all day, which is what they signed up to do to care for patients, but then they have to go type the notes for the rest of the day and then go through all of the lab results and all of the portal messages with your just one more thing, just one more question. So it becomes a little overwhelming. So there are some systems that are popping up that are helping with inbox management, because you can just say, oh, you can delegate that to your nurse or your medical assistant, but they're also doing things as well. So we want to take that administrative burden off of the entire team so that people will feel fulfilled and work to the top of their licenses and want to come to work every day and do the things that they do. So they have things like the inbox management that are coming out that are supported by AI and technology. They have AI assistant scribes where there have been difficulty with certain practices asking, can someone come in and help scribe the notes like they do in some emergency rooms and urgent cares in private practice offices? But it's costly and you have to hire new staff and they have to follow you around all day in the room and the patient privacy and all of those things. So now they have more systems in place where you can have AI kind of scribe for you and you're done with your notes when you finish the visit.
These proven to be effective. I know in the past, one of the problems was the accuracy of these programs, that there may be a lot of going back and forth and figuring out if what it said was actually said in the conversation with the patient. So how accurate are they, I think, and I want to ask also, has that actually shown a higher satisfaction amongst the physicians?
So there is so much competition right now in the startup world, and there's always that group that's trying to be their best. So there are a lot of different organizations that are looking at the accuracy, and it varies, to be honest. I don't want to call out a specific name, but there are some larger health groups that are using, and I'll say one, like Kaiser is documented, it's out there in the news that they are trying to implement this year, where they're helping with the inbox management, the note taking and things like that. And they have been seeing some improvements in provider satisfaction. I don't have any particular studies listed, but I can definitely vouch for my friends who are still practicing clinically, and the ones that are doing it in those kinds of systems feel quite a relief, and they're not staying to work as late. So I think over time, as all of this new technology comes forward and there are more studies and more papers that come out actually looking at the effectiveness and the productivity, it'll definitely allow more systems to implement it.
So what you say makes perfect sense, and I can really see how that relates to the primary care physicians the most. Now, thinking of specialists, let's say it's a cardiologist or some specialist, what do you think is going to be best in terms of better retention of those types of physicians, as well as on the other side, taking care of it administratively? What do you think is probably one of the biggest challenges to be overcome, or one of the most important things that organizations should be looking at?
I think a great thing that is very important for specialists is the reimbursement. You have to make sure that your notes are structured appropriately and you've coded it appropriately and what's within the regulations and guidelines of what you've done during the visit. But once you do that, what's next? You have to be reimbursed. So with that, technology is definitely improving the way that you're working to get reimbursed. So there are things that can help with the coding and the billing so it won't be left on one staff member. There are even opportunities where a lot of times where patients may need a higher level of care, who may need different medications that can only be prescribed by a specialist, or they've tried a certain number first and they need a thing called a prior authorization, where a patient can't get the medicine unless their insurance says it's okay, even though the doctor recommended it. It's our system. So the doctor has to write back to them and say, like, actually, they do need this medicine. I don't know why you denied it. And you have to prove through your notes what they've taken. So if we have notes that are optimized or showcasing what would be needed in a particular prior authorization, and then processes that can help navigate that without having the middleman call back and forth, it definitely will improve satisfaction of needing to have a provider do a peer-to-peer where they're talking through with their colleague about why they need a medication that's already noted on their note.
Good points. Have you seen success, or have you seen this successfully implemented by organizations where they are able to address these challenges, perhaps by the use of technology?
Yes, there are a lot of startups kind of popping up to fill that gap in terms of prior authorization management because it's something that a lot of providers are crying out about because it can take so many hours in a day just to do like double work of trying to advocate for your patients, which is doing right, but advocating for them on something you already told the insurance company that they needed is duplicative. So there are companies that are coming up to assist people with that. And even on the back end, some of the insurance companies are implementing strategies to utilize AI and which can help with machine learning and seeing things to learn what to pull out of notes and stuff that patients have done. And it's been successful in some cases, but you have to be careful when you're implementing technology to make sure that you have people who are doing appropriate research, who are looking for things that showcase bias and are just doing due diligence for the patient. Because as we've seen in the news, there have been a few insurance companies, one of them being United Healthcare, who's kind of come into a huge conundrum because they were allegedly denying patients things utilizing the AI and machine learning that they shouldn't have denied. And it actually denied, I think, 90% of cases that should have been approved. So they're in a lawsuit, which we have to look further into it, but it shows that there is promise in teasing through things, but you have to have the correct people on staff that are setting up your technology, and you cannot only depend on the technology to do the work. So you have to have a pair of eyes that come and look and see what's different about this so that you can make sure that you're doing the right thing for the patients.
Makes sense. Yeah, absolutely. Well, I appreciate you sharing your insight. And I no doubt this will help many of the organizations that are watching, especially as it relates to our channel on YouTube or as well on LinkedIn through our healthcare executive group. I want to thank you for coming on. What are some things you could perhaps add in terms of what you're working on right now and how you might be able to help some of the folks who are watching?
Oh, I love talking about that. I could talk about that all day, but I have a few things going on, but I am the principal consultant of my consulting firm, Digital Risk Compliance Solutions, and we help healthcare organizations that are committed to digital health excellence minimize risk and expenses due to non-compliance, as well as help them optimize workflows. So these things that we're talking about, we can think through together with your executive leadership and help implement them and help address those things that are happening to improve patient outcomes.
That's great. So what's a great way for folks to be able to get in touch with you?
Love to chat with anyone that I can be of service to. So a great way to reach out to me is my email, or you can check out our website, digitalriskcompliancesolutions.com. And there you can check out our services as well as set up to have an appointment.
Very good. Excellent. Well, thanks for coming on the show today.
Thank you for having me.